So by far and away, the most common cause of a child's cough would be a respiratory virus. And so what happens there is that you first start out with like the runny nose and the response in your nose from that virus kind of getting in there. And then as it travels down the respiratory tract into the lungs, you start producing mucus in your airways, and the cough is your lungs' effort essentially to try to eliminate that and get rid of that mucus, get rid of that infection. More serious causes of coughs would be if your child has asthma, for example. You can definitely present as a cough or croup, like with a croupy cough, which is another infection, but can be a more severe type of cough. Then you can also have more severe reasons to have a cough, like a bacterial pneumonia that you would definitely want to be treated for, or like whooping cough pertussis is another rising cause of cough in children. The red flags would be if they are having difficulty breathing. So specifically, if you're seeing that they are breathing very rapidly above their normal level, or if they're having to use extra muscles to breathe. So like if you took their shirt off and you saw that they were like sucking in their belly, or if like we call it flaring of the ribs, where like in between the ribs you sort of see it going like this, so they're kind of flaring like that, or if tracheal tugging, that's where this muscle here is being pulled in. And those are all signs that the child is really having to exert themselves to actually get air into their lungs. Or of course, if their lips were turning blue or their fingers were turning blue. Less dramatically, if the cough is associated with a high fever. By high fever, I mean like up over 102, 103, then you at least would want to consult with your primary care provider to see if you do need to worry about something like a pneumonia. If it's a young child, so generally a child under age 3 months with any fever should be seen whether or not they have a cough. Under 6 months of age, if they have a cough, that'd be probably worth talking to the pediatrician to see if it's reason for concern. And then if the cough is going on for more than, usually we say like 10 to 15 days, then it might be worth bringing them in to get a good look and listen at them.